Hi. Hello. 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 How are you doing today? You must be my next patient. Yes, it is great to see you. I'm so happy to see you, but unfortunately not under these circumstances since you said you're not feeling well today, right? Okay, yeah, so have I seen you before? Like I said, you look really familiar. You've never been to my doctor's office? Okay. Interesting. How did you find us? On Craigslist. Yes. Okay. Yes. Well, thank you so much for coming into my back alley doctor's office. Like I said, my name is Dr. Luna. Yes, I am in fact a very certified doctor. Let me show you my certifications. Just gotta get them from my doctor bag. My lovely doctor bag they give you when you graduate Doctor University. So anyway, here is my certification. Okay, so it says dentist, but I can assure you that I am also a medical doctor, and I am certified to give you this exam at a discounted rate, of course. So, what seems to be the problem, Pookie? Okay, let me just write that down 1 second on my doctor pad. So, what is your name, by the way? It's not Pookie. Okay. And what is the problem? Okay, you are having some abdominal pain, like a stomach ache or like cramps. Okay, a little bit of both. No worries. We will take a look at that. And do you think that it could be because you overate? Or like ate the wrong thing? Have you thrown up at all? Okay, let me write that down. Perfect. I mean, not perfect because you have a stomach ache, but you'll feel better later. Let's get started. So I'm gonna start with my doctor gloves. Doctor gloves, I just need to put them on because, I don't want to catch any diseases from you. Not that you have any diseases, but just in case. I wouldn't want to catch them. It's a 101 at Doctor University. Let's see. Let me get my gloves out. Okay, hopefully they will fit because I bought large gloves by accident last time and I have a whole box of them, but they're a little bit baggy. And I didn't even realize until I looked at the box. But yeah, this is a fresh box of gloves just for you, Pookie. Let's see. So I'm gonna take a look. I'm gonna start by doing just your vitals. I'm gonna take a look and put some pressure on your abdominal area. Is that okay? Okay, when was the last time that you ate? I don't want to press the food up or anything. Just gonna, can you feel that right here? Okay, do you have pain here? Just adjust these. Do you have pain here? What about here? Okay, here. And here. Here and here. Okay, so you have some pain when I press on it. Well, that makes sense since you said that you're having abdominal pain and a little bit of cramping and a little bit of a stomach ache. Alright, I need to check the rest of your vitals to make sure that you're okay, to make sure that you're not immediately dying, because if you were, you would have to go somewhere else. I would recommend the actual emergency room. Let's see. I'm going to begin by simply checking your heart. So I'm just gonna lift your shirt in. Okay, deep breath in and out. Okay. Heartbeat is really fast. Are you just nervous to see me? Yeah, that's what I figured. That happens with a lot of clients. Now, let's see. Sorry, this is a little broken. Our budget is a little bit low, but put your arm out. I'm gonna check your lovely blood pressure. Okay, ready? And okay. Yeah, it's a little bit high. I would suggest that you lay off some of the snacks. You know, it could be part of your stomachache issue that you're having. Let me see what else. I just want to look in your mouth. So I'm gonna get my light. This is a popsicle stick. You know, a regular popsicle stick. And open your mouth. Go. Okay. Good. And I'm gonna take my light and look and go. Open wide. Good, good, good. Alright, let me look in your eyes. Okay, you don't have to follow the light yet, but we may do that a little later if you do in fact require a cranial nerve exam. And this side. Alright, let me look in your nose. Okay, a little bit of boogers, little boogie. Let me look in your ears. I'm just gonna poke in this one. And other ear. Okay, so let me see. Let me just take your temperature. Don't worry, this one is not going in the booty. You are in the block because we don't do that here. That would be inappropriate. And I'm a very appropriate doctor. I take this. And it's just like a little light. I'm gonna put on your forehead and okay, temperature is normal, so that's good to know that you're not dying. You're gonna be okay, I think. We'll see. I still have to do some other stuff. But anyway, let's see. So it seems like you had some abdominal pain. We are in fact going to have to do a cranial nerve exam on your stomach, but also we're going to check your eyes. We're going to check your I almost forgot because I just graduated Doctor University. We're going to check your taste. We're going to check your smell, your hearing, and your senses. Most important, we're going to make sure if you have feeling in your abdominal area and see what happens. So let's see what we can do to get started. I'm just going to start with a simple eye test. Okay, now I have this one for babies. Can you read? You can read. Okay, so you don't need the one with the pictures because you're a grown adult. Okay, I'm just asking. I need to ask if every person can read here. And do this one. So I'm going to start with a simple eye test. I want you to tell me what this is. Read this line, please. Okay, read this line. Alright. This. Alright, I'm gonna move it a little bit farther back, make it a little bit more challenging. Can you read this last line? Can you read this? Right here. Here, let me get a little closer. What does it say? Okay, seems you have good vision, unlike me. As you can see, I have the glasses. I don't have the best vision, but you, Pookie, have 20/20 vision. Congratulations. 20/20 vision, yeah. And you are really cute, by the way. I'm just saying, you look really good. You have a really, really nice, symmetrical face. Has anyone ever told you that? I don't want to get inappropriate though. I'm a very appropriate doctor, like I said. Next, we're going to continue your eye test. So, I want you to look at my hand. I'm going to shine this light. Shine the light in your eyes on this side. Look at my hand. Okay, do you see my hand? Okay. And focus on my hand, not on the light. Alright, just. And blink. Blink. And blink. Let's do the other eye. Ready? Okay, look at this hand. Don't look at the light. Do not look at the light, or there may be consequences. Look at this hand. Good. And blink. Blink. And blink. Okay, now I want you to look at the light. I know I said don't look at the light, but now I need you to look at the light. Boo-boo. So, focus on the light. Follow with your eyes. I'm going to move it across the screen. Ready? Focus on the light. Yes. Yes. Good. Yes. Yes. Good job. Okay. Good. A little faster. Good. Yeah, your eyes seem okay. I'm very, very surprised. I do not run into a lot of clients with 20/20 vision. It's very rare, but you have amazing, amazing eyes. So congratulations on that. Now let's see, what else did we do in Doctor University? Like I said, I just graduated with a cranial nerve exam. Oh, can I offer you a slice of pizza, by the way? We have some leftover in the office, just in the middle of the exam. Okay. A pizza a day keeps the doctor away. Don't forget that, unless you want to see me. Okay, next up we are going to do a smell test. Unfortunately, I only have these Sharpies. I know they say Sharpies are not good to smell, but these are special doctor scented Sharpies. So I'm going to take these Sharpies and I'm just going to put them right in your nose. No need to worry at all. Don't worry. It's not toxic. It's a special Sharpie. Anyway, I'm going to start with this one. And smell this. What do you think this smells like? Okay, let me get a little closer. Okay, you think it just smells like Sharpie? No, this is a special scented Sharpie. So what does it smell like? It's green. Take a guess. Lime. This is a lime Sharpie. Alright, now next one we have here. Ready? Okay, I'm gonna get close to you. Let me get a little bit closer to you. I just wanna give it a sniff, please. Okay, what does this smell like? Here, I'll put it in your nose more. Okay, it's smells like strawberry. You're right. You were actually right on that one. The first one, though, I don't know why you said it just smells like Sharpie because it's a scented Sharpie. Although, I might have mixed it up. Okay, this might actually just be a regular Sharpie. Sorry about that. You might have lost some brain cells sniffing it, but you'll be okay. Don't worry. You have a lot of brain cells, so it's okay to lose a few. No need to worry. Don't sue me, okay? Now, let's see. Next up, we are going to do a lovely little taste test. I have a few different dropper bottles with different liquids in them. Don't worry, all safe for consumption. And I'm just going to take some and drop it right on your little thing. Just 1 second, boo-boo. Okay. Give that a sniff. What does it smell like? Okay, it smells like a fart. Oh, that one might be expired. Sorry. Let me check. Let me get a different one. Okay. Different spray bottle. Next one. And what does this smell like? Okay, it smells like wet dog. That is correct. That's correct. Correct. Except I just realized I'm supposed to be doing the taste test, so I also need you to taste this, okay? Can you just taste this, please? Okay, it tastes a little bit sour. Alright, let me give you a new one. Sorry, I didn't mean to make you smell that. I meant to make you taste it. Okay, taste. And is that sour or is that sweet? It is also sour. Okay, let's do the third one. Here you go. Taste. Okay, it is all sour. Well, that's correct. I think that they're a little bit expired, but you'll be okay. You'll be okay. Don't worry. It seems like everything is pretty well. Okay. Oh, I was like sweating. Sorry. Let me see. Next up, we are going to do a hearing test. Lovely little hearing test. I'm going to just take this tuning fork and put it in your ears, and we will see what happens. Ready? What side do you hear this on? Can you hear it at all? Okay. How about now? Oh, that might have been a little loud. Okay. How about now? Shh. Listen. Okay, next side. What side do you hear it on? I'm gonna switch. Raise your arm. Okay, raise your arm. Okay, and let me see your ear. So we have a model of an ear here. As you can see, there are a lot of different aspects to the ear, and you have different pressure points in the ear. So I'm just gonna go in with your ear and just take a look. Just wanna press all of these points. Right, exactly. I'm just gonna go in and okay. Alright, yeah, so you have a lot of wax, but other than that, I think your hearing is okay. Let's get to the sensory exam reflex test. I'm gonna take this and put it on your stomach. Are you ready? Okay, let's see if you react. Yeah, you reacted. Sorry if that hurt. I just had to do it, okay? It's part of the test. Next up, we're gonna do soft, sharp, or dull. Sharp or dull. Sharp or dull. This is a little bit sharp, but I promise you it won't hurt. It'll just be a little prick. And this one is very, very soft. And I'm just gonna put them over your area where you say it hurts. And I want you to tell me what kind of feeling you have, if it is sharp or dull. Sharp or dull. Sharp or soft. Sharp or soft. Okay. Ready? Let's see. Okay, it's soft. Is it dull as well? And what about this one? Okay, it hurts a little bit. Sorry. I'll go a little lighter. Okay, sharp. Sharp or dull? Okay, dull. Let's go again. Is it sharp or soft? Sharp or soft? Okay, one more tool. And please let me know how that feels. Is it soft or is it sharp? Okay, so it's looking like you have a little bit of a loss of feeling in your stomach area. Let me compile all the test results and I will tell you your diagnosis. Interesting. So, the diagnosis is that you are pregnant. Congratulations. These are your babies. You're going to be a father. Congrats. You can pay at the front desk, okay? Thanks so much.